Hello there. Thank you for clicking on this poster presentation. In this work, we want to evaluate the performance of 4 data-driven methods to extract respiratory signal from cone beam CT projection images using MR-based digital phantoms. As an introduction, previously we managed to develop a methodology to generate a 4D digital phantom using 4D MRI data. Some of the advantages of using MR-based volume images as digital phantoms include number one, having actual free breathing motion from the volunteers, thus not the robotic-like patterns in other phantoms. And secondly, the MRI images contains soft tissue information that is unique and independent of each other. In the previous study, we customized the digital phantom, or DP in short, to match a 4D CBCT and thus enabling us to carry out tests and simulations on it. With regards to 4D imaging, information on respiratory motion is important. Therefore, another advantage of using the digital phantom is the availability of a ground truth respiratory signal that can be obtained from the phantom. In this study, an additional 4 sets of MRI data from 4 other volunteers are used to generate in total 5 digital phantoms where the ground truth respiratory signal of each DPs are determined. Using these 4D CBCT DPs, we simulated another 5 sets of projection data based on the CBCT half-band acquisition operating mode. The setup is typical in external beam radiotherapy treatments, EBRT, for lung cancer patients. Here is an example of the simulated cone beam projection of the DP, obtained from a 360 degrees view angle for approximately 1 minute. In this study, to further evaluate the performance of the data-driven methods to extract respiratory signal from this projection data, we defined the projection data into several regions of interest. Basically, the projection data is separated into 3 main regions. Region A, where the diaphragm is primarily located. Region B, the inferior mediastinum region where the heart is located, and region C, the superior mediastinum region where neither the heart nor the diaphragm is visible. Permutations between these 3 regions yields another 3 ROIs, thus giving altogether 6 ROI parameters. The justification for the selection of these regions are because in the projection data, although we want to primarily extract the respiratory signal, motions from other organs might affect the performance of the data-driven methods, especially cardiac motion from the heart. The 4 main data-driven methods to extract respiratory signal from the CBCT projection data are shown in the slide below, details of which can be found in the reference. In the results, we can see that all 4 methods managed to extract the respiratory signal from the projection data. But the initial results when using a full projection image actually indicated that the LPCA method has the highest overall mean local correlation between the extracted signal and the ground truth of all 5 digital phantoms. For clear visualization, the results are plotted in a box plot as shown in the slide. You might be wondering what the trailing red crosses are. Well, those are what we call the local correlation outlier values that are detected in the results. In this study, we use a local correlation metric in order to evaluate the intricate properties of the extracted signal. We defined a window in which the signals are progressively evaluated as shown here. Therefore, values that are considered outliers are insignificantly discarded from the analysis. Overall, we can see that in certain ROIs, all data-driven methods display poor performance, especially when the diaphragm is not present in the image, such as ROIs B, C, and E. As mentioned earlier, when the full projection image is used, the LPCA method has the highest correlation compared to the other 3 methods. However, the FTP method has the highest accuracy when the ROI only includes the diaphragm. As a conclusion, this study showed how a digital phantom using 4D MRI data provided the necessary ground truth to evaluate the performance of the data-driven methods. The results indicated that these methods displayed promising results, highlighting the robust potential of the LPCA method when using the entire full projection image. And lastly, even though the FTP method showed the highest correlation value compared to the other methods, but this only applies when the ROI selected only contains the diaphragm. That's it. Thank you very much for your interest and attention. If you have any questions, feel free to ask in the section provided. Thank you and bye-bye.